Hello. Hello, Amina Beg.
Mm. Hi, hello, I'm audible.
Yeah. Mhm. We are on live now. And
Mhm.
before going to start your session, I want to introduce you to our audience.
Sure.
Amina Begum Sumi is a certified counseling psychologist and parenting coach in Bangladesh with an MPhil degree in counseling psychology from the University of Dhaka in 2022. She has been working in the mental health profession for 10 years and is currently the head of psychotherapy at the Inner Child Mental Health Clinic and an international psychotherapist with Living with Wellness. Amena specializes in individual, couples, and families' dilemmas, focusing on transactional analysis therapy (TA), systematic family therapy, and neuro linguistic programming. She has worked experience with numerous national and international organizations. In 2021, she attended the International Mental Health Conference Mind the Gap Contemporary Topics in Mental Health virtual, and in 2018 she joined the 6th Asian Cognitive Behavior Therapy Conference Mental Health Gap in Asian Countries Scope of CBT, Dhaka, Bangladesh. Amina is the first therapist in Bangladesh who applied transactional analysis therapy on couples to identify therapeutic outcomes related to depression and marital adjustments. That was a wonderful bio, and you have done really great job, Amina. And the stage is all yours.
Thank you, Merinda. And I'm really happy to see you. And yeah, okay. Um, yeah, it's good. Mm, yeah, it's perfect. Welcome to our conference. And this is the Global Summit Conference, and I'm really excited to join the conference. And this is the very awaiting event for me. And hello, and everyone from the participants and audience to my presentations. Now I'm going to present my presentation. The next slide. Okay. The next. Yeah. Can you? Okay. Yeah. Thank you. Today's my presentations. I'm going to present my MPhil thesis. It was my MPhil work. The title work was The Effectiveness of Transactional Analysis Therapy on Depression and Marital Adjustment of Couples. And I was the researcher and therapist on the research work, and Dr. Mehtap Khanum was my supervisor, and that was my MPhil work already Miranda said, and that time I was the student of University of Dhaka. And one interesting information is that this is the only one research that I conducted on transactional analysis therapy on depression and marital adjustment of couples. Before, there was no research work happened on that, especially on transactional analysis therapy. But when I working on this therapy, I see the lots of the research work based on marital adjustment and depressions like CBTs and RBTs. But this is the only one therapeutic work that I did, and I really happy I can present this therapy is like at the global summit. Okay, the next slide. Uh, okay, the background. I'm just introducing the little bit on the background. Is the what's the topic I cover in this research? Okay, there's the mainly three topic: the depressions, marital adjustment, and transactional analysis. These are my major focus on this research. Okay, depressions and marital adjustment are close related. Why this is close related? Because as a therapist, when I work with my client, and that time I was a trainee counseling psychologist, I see sometimes Some individual client came to me with the depressive symptoms. And when I explore their conjugal life, if they are married, then I see the most of the marital maladjustment in their conjugal life, the relationships. And sometimes I saw that the poor communication also increased the marital conflict, and but the couples, the person wasn't aware about this, the what kind of communication they are doing in their all conjugal life. So that time I noticed this is the one of the my therapeutic interest, and why I choose this therapy, because when I work as a trainee counseling psychologist, I saw I as a work the lots of the couples, and they are coming their marital conflict, marital dilemma, dissatisfactions, but there is the transactional analysis therapy. It also can be a great therapeutic approach for resolving these issues. It was one of my concern, and that why I chose this therapy. And I already said the transaction analysis therapy. This is the developed by the Eric Berne in 1950, and the Eric Berne was the psychiatrist, and he said that transactional analysis therapy is a theory of personality, theory of communication, theory of development, and also theory of relationships. And Barnes said the transactional analysis therapy is the aim to improve the communication and emotional well-being the person. So, and this is my main focus in this whole research work, and I already did it, but there is an one thing is the limited. I try to pick up the one examine like as the experimental and control group, but the research is really so practical, and most of the couples comes to their real issues and we provide the research. So this is really hard to arrange this the another groups. Okay, the next slide is okay, the objective. Okay, yeah, the my main objective was that to evaluate the whether the transaction analysis therapy is reduce the depressions or improving the marital adjustment among the married couple in Bangladesh. Yeah, that was the my main concept objectives. I mean, main concern I wanted to see. And my hypothesis, I already hypothesized that, yeah, there is an yeah, positive impact on transactional analysis therapy to reduce the depressions. And my another hypothesis was that, yes, transactional analysis therapy helped to improve the marital adjustment among the couples. And the yes, the variable was that independent variables was the transaction analysis therapy, and the dependent variable was depressions and marital adjustment on this research. Okay, the next slide is yeah, methodology. Yeah, this is actually I designed the slide very precise, but the work was not very easy because this is the couple counseling. I have to follow the lots of the step, lot of couple sessions. But yes, all have to follow the one that methodological process when we work as a researcher. Okay, the I follow the research design is a repeated measure design because there is the three step. Okay, the pre and post and follow up. I have to collect the data from the three step by step. That's why the repeated measure designed. And I already said that there is the no control group because the all is the real couple sessions, and everything is doing is the in the real counseling session. It was not that like as not the experiment. Yeah, I told to my client, we are presenting you data, we are working with you data, but the session was the genuine and real. Okay. The participant was, yeah, there is a small amount of participant, that 20 married couples, and they are all selected from optimistic basis from a clinic in Dhaka, Bangladesh. My whole work is focused on Bangladesh culture, context, and in the cities in Dhaka. And the measure, yeah, I use two scale, the depressive inventory scale. Of course, as I work as a Bangladeshi people, so I use the Bangla versions. Uddin and Rahman developed the Bangla version, and the look well as marital adjustment scale, that is also I used in Bangla versions, and with my couples to see the therapeutic effect. And the assessment was three tests, like as I repeated already said, that if the pre-test, post-test, and follow-up, and the follow-up for all couples, it happens after 1 month of the therapy. Okay, the next. Oh, well, this is the main focus on my research and my uh, therapeutic approach, the counseling process. Okay, so as this is not like the test and result. This is all the what said the treatment process. I have to give something to my client to see the transaction analysis therapeutic effect. So I followed three stages. First, exploration stage, then second one the intervention, and the third one is the termination. So in transactional analysis therapy helps people to understand their interpsychic process, their ego state, and also the transition analysis therapy helps to find out their past thoughts that was they are carrying in the present life, and that may influence their communication pattern. The therapist, as a therapist, I focuses on exploration step three three concept. There is the first one is the structural functional of ego state. I introduce with my client what is the structural is ego state, like as the parents, adult, and child. That is the main focus on the transactional analysis therapy, and the function of the parents, adult, child, how parent, adult, and child work on in a person's inner mind, and how a person interpsychic and intrapsychic process is communicating by those ego steps. And then I introduce the transactions, that is the communication pattern, like so once couples communicate with the another couples, how they are talking, how they are behaving, how they are thinking, and after their thinking, after they are behaving, how they reflect their emotions to one another. That all the things I explore within the exploration session with my couples, and the intervention sessions. This is the most important session for my research, because in these sessions I introduce the drama triangle. Okay, what is the drama triangle? This is very important, and the psychological game and both. So when a person communicate one and another, the person sometimes they play as a victim role, sometimes the another person is play the persecutor roles, and sometimes one and then they are unconsciously playing as a rescuer role. So all the roles, sometimes the couples, husband and wife playing, but they are not your, okay, they are not your. So in my intervention process, I focus on that how the drama happen, how the psychological game is happen, the loss of the blaming game in our conjugal life. We are practicing, we are doing unconsciously and consciously, but this is the main focus. The therapist helps to find out the how many psychological game a couples carrying on their mind, and they are practicing and they are doing in their partners. And the intervention, the what is the aim, the psychotherapy, transactions therapy what did transactions therapist actually did the decontaminations, and their adult thinking, the increase or they develop their adult strengthening ego state. And this is the main part of the intervention. And the termination is also the therapist follow-up sessions and relapse prevention tips, and review all the process when they come to the termination stress. Okay, the next is mm, uh, okay. Thank you. In exploration stage, I already explained what therapists did, but I just show up here on my slide. There is the how TA is working, how the model is TA is showing. Looks, there is the circle. This is the main iconic feature of transaction analysis therapy. The circle, yeah, the parents, adult, and child, everything, what the parents behaving, how adult thinking, how the child is working. And I already said the communication, yeah, this is the very important one. I'm just showing the very shortly. The complementary communication is the most focus on my therapy, because the complementary communication is a adult to adult communication. That means the logical communication, that means the present communication. And all the others two communications, sometimes they are not working well, they are creating conflict. And this is this whole scenario of exploration sessions on my research. Okay, the next slide is mm, yeah, next. Yeah, this is, I already explained the how intervention session design here looks at the rescuer, the victim, and the persecutor. Okay, the main therapist main focus on help the client to be a creator, to be a coach, to take the challenger. These are the main what's said the main core therapeutic approach in transaction analysis therapy. After the sessions, after the therapy, a person can be a curator rather than a victim. A person can be a coach rather than a rescuer. A person can be a take challenger rather than a persecutor. This is the whole changes of this therapeutic approach. Okay, the next is, yes, the termination, actually decontamination and deconfusions. This is the main therapeutic I already explained. So decontamination, not contaminated one another. The separate ego state behave like present, and no confusions. When a couples finish their therapeutic approach, they they act really well on the decontamination and deconfusions phrases. Okay, the next is, okay, so what the result? Okay, in my therapeutic approach, the result is that the depression approach is a significantly change. After the pre-test, post-test, and the follow-up sessions, I see that the depression score is lower. The lower depression score indicate the no depression, and the marital adjustment score is higher. The higher depression score indicate that the good marital adjustment, and both are the significantly proven and the significant improvement I see on my finding. And the depression significantly reduce, and the marital adjustment the significantly increase after the intervention. This is really happiest moment for a therapist and researcher. Okay, the next session, next slide. Okay, discussions. Okay, what the main focus on this and what we have. Okay, improving communication. TA helps people to improve their communication. TA helps couples. They improve their communication pattern when they talk one and another. When they communicate each other, they are really find out their ego state, and they can change their ego state, and they can change their what they wanna do. They can avoid the argument by improving their communication pattern and reducing psychological game. This is a very one of the good changes, because some before therapy I saw my couples blaming games, lots of blaming God. After the therapeutic session I saw the most of the couple, they are very aware on their psychological game. They know what is going and what is the ending of this game, the result of the game. And increasing emotional wellness is very important. When the couple's emotional wellness is improved and increased, the depressions is really controllable, and they can work on their depressions and enhancing intimacy, improving marital satisfaction. Yes, this is that in transaction analysis therapy is not only the couples therapy. This is really excellent therapy for enhancing their intimacy, because after the sessions I saw the couples can spend their times, their conjugal life together, and they can able to spend their self times like a withdrawal time. They're enjoying their withdrawal times and self caring, self awareness, self motivation, everything I saw. And the next one is the conclusion is, yeah, as a successful researcher and a successful psychotherapist, I can conclude on the transactional analysis therapies is effectively reduce depressions, the marital adjustment improve significantly, and the findings support the transactional analysis therapy is a promising interactions for couples. And there is the also on this is the very global summit. I already said this is the only one research work I have done on my country from my side, but I requested to all of audience, if anyone feel connected on this therapy, and if anyone working with the couple therapy, they can also work as a larger context on this therapy. I think they feel good result, and they see the good result, and they feel very happy when they see the good changes on their couples. Yeah, the next is, yes, this is the, oh, I'm done on my sessions. Yeah, this is the question sessions. And okay, before taking the questions, I wanted to add one information about me now. Yeah, I am working as a counseling psychologist online, especially for my Bangladeshi client, and I am now the member of American Psychological Associations, and really I'm happy with the member of these being great associations, and I can learn lots of things. I can share my ideas with these members of associations, and this is very great achievement for me also. So okay, any questions? I am really happy to answer the questions. Um, Melinda, are you here?
Yeah, Amina,
Yes,
that was
hi,
an
Melinda.
interesting presentation.
Thank you.
You had done a great job, Amina. And we have got few questions from our audience, Amina.
Mm-hmm.
I want to ask you one of them.
Mm-hmm.
How does depression affect marital relationships?
Okay. Actually, when a person is depressed and she can or he cannot focus on their relationships very well, this is really vice versa. So you are not feeling good on your personal life, or in your inner feelings is not good, so your reaction and your delivery will not is the healthiest. So at first you have to work on your depression yourself, your inner feelings, then you can give the good partnerships, good companion with your partner. So this is really interconnected, depressions and marital adjustment.
Yeah, thank you so much for answering. And we have one more question. How can TA therapy help reduce depression?
Okay. Okay. TF is a therapist of therapy of communication, self development also. So what therapy said in pre-therapy, we have a lots of therapeutic window, right? So there is a when a person depressed, the person is not aware the depression feelings where that came. Actually, the depression feelings came for our child ego state. Our child ego state was the depressed, but the persons wasn't aware about the child ego state, the child emotions. So when their TA helps the person bring the adult, like as the presence, oh, you are depressed because the reason is this. But sometimes the depression reason is not um, uh, is not in the present focus. The issues was the past, the feelings we are carrying on the present, right? So to help the person being aware on their present activity, present awareness. Yeah, okay, I have a lots of issues, like I have a breakup, right? But that is the past. But now I have a job, I have a responsibility, I have a child, I have a family. I'm not focusing on this aspect. So T helps a person see the blind spot, the adult. We all are, we are just focusing on our what I am losing, what I don't have in my life, what I wanted in future. But this is all of our jumping. But only TA focus to be a person here and now. Okay, everything is beside it. At present your role is that's and you're just working here, and T helps timing, a timing activity. There is the lots of timing window with self improvements. So T structure a person's time. There is a time management in the T therapy. So if when you are following the 6 time management activity, this is really working what said very good to reduce your depressions and um, improve your marital adjustment and uh, uh, your whole presence sense, that I say that to be a here and now.
Thank you, Amina. We got your answers, and thank you so much for your valuable time today. And please be on the backstage and join the next session.
Thank you to you, and I'm really happy with the part of this your summit.
We too honored.
Bye.
Thank you. Bye bye.